Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines Bryant. Our guest today is Dr. Puneet Chopra. He's the Chair and Medical Director of Observation and Emergency Services at Doctors Community Hospital. Welcome.
Thank you for having me, Stephanie.
Dr. Chopra, we're talking about something that's been topping the headlines now for some time. We're going to talk about the Zika virus today. And it has been big news around the world. Let's start off with the simple basics. What is the Zika virus?
The Zika virus is a mosquito-borne illness that a person can contract when they're bitten by a mosquito. When the mosquito bites them, they can develop symptoms such as fevers, joint aches, rash, conjunctivitis or red eyes. Most of those symptoms are relatively minor. A person just won't feel well. Most people don't even get symptoms from it, but carry the virus.
Now, we're just hearing about the Zika virus, but it has a long history. It's been around for a good long time.
Actually, the history of it is quite fascinating. It was discovered in 1947 in Uganda in the Zika forest, hence its name, the Zika virus. And from there, it was mostly contained in Asia and within Asia and Africa. And somewhere around 2007 or so, it started propagating outside of that area to the French Polynesian islands. And then from there, around 2015, they noticed an outbreak in Brazil. And coincidentally, in 2014, there was the FIFA World Cup, which is a huge international event that was hosted in Brazil. Now, they're not sure if there was any connection, but that is definitely something to take a look at. So in Brazil, around May of 2015, they noticed a big spike in Zika virus. And they correlated that with a big spike in birth defects, specifically microcephaly, which is where the head is very small of the baby, and that can lead to birth defects, brain defects, because the brain is not allowed to develop due to the size. And so they saw a very big spike in the incidence of that, up to 4,000 cases that are known reported, whereas prior to that, there's only several hundred cases a year for many, many, many years, which is the norm. So that's what's made that connection.
As a layperson, can you explain how it goes from being a mosquito-borne virus to a sexually transmitted virus?
So it's a great question. So let's go back and look at exactly how the disease is carried and then transferred. So it actually sits in a human, and then when a mosquito, the specific mosquito bites you, and it's a female mosquito, because when they bite you, that's how they feed on our blood. So when they bite us, if we are a harbinger of the Zika virus, then now the mosquito becomes a carrier. The mosquito, it goes into their bloodstream and ends up in their saliva. So the next person the mosquito bites, that same mosquito, now becomes infected with the Zika virus. And a normal feed for this female mosquito is about 4 to 5 bites, if you will, 4 to 5 typically different people that they bite, that they now have infected in one feed, which is why this can sort of get into the population very quickly and become quite a big problem.
Does the mosquito die?
The mosquito doesn't die. And then how does it become a sexually transmitted disease? It's much like any of the other viruses that we contract. It's through our bloodstream, because that's how the mosquito contracted it, was through our blood. So sexual activity, when bodily fluids and blood is contacted between humans, that is what's thought to be sort of how we transmit it to each other and how it becomes a sexually transmitted disease. It's also thought, there have been cases that have been studied and reported where it's in the semen of the man, and that's what it's carried also in for at least a period of time. And so that's also another way that it can be carried.
That's my next question. How long does it stay in your body?
So it's a great question again. So it's thought to stay in our body for up to 2 weeks, where we can be symptomatic with it. Now that being said, the CDC's guidelines on what they're recommending in terms of taking the precautions to prevent spreading of it is that if a person has traveled to one of these areas, they should abstain from either having any sort of sexual activity or use protections such as condoms specifically for at least a period of 2 weeks before they try to conceive. If you are a man, you're supposed to, that's on the woman's side. If you're a man, because it's going through the semen, their thought process is that it can last longer in the semen, and they don't know why yet. A lot of studies are still going on this. But they're now recommending that for men, up to 6 months that they abstain from having any sort of unprotected intercourse to prevent the spread of this.
If you're a pregnant woman, or if you become pregnant during this time period, at what point does the virus affect the baby? Is it in the first, second, or third trimester?
So a lot of the things with the Zika virus are still sort of in the category of what do we know and then what don't we know. Because it's sort of new to the area and to this part of the world, it's now starting to affect the United States population. The CDC is now getting involved. There's a tremendous amount of research and activity going on with specifically the Zika virus. But again, it puts a bunch of things in the what we don't know category, which, on your question, is we don't know exactly where in the pregnancy it's affecting the fetus. It could be the first, second, or third trimester. So that's why currently all the guidelines and suggestions are that the precautions are taken on any pregnant woman who goes to one of these endemic areas, which are mostly located in either Central America, South America, or the Caribbean currently, although there have been some cases reported even in the United States, in Texas and in Florida, that those women get tested for the Zika virus if they are known to be pregnant. The other population that should be tested is people who are becoming symptomatic. If they're becoming symptomatic and have traveled to that area and are potentially having intercourse, they should be tested as well. The CDC has specific guidelines that if you go to your local hospital, so for example, if you came to Doctors Community Hospital, where our trained emergency physicians see patients, we would follow the CDC guidelines and work with our local state authorities to screen patients. If they fall in the screening process requiring testing, we draw the blood samples that are required and send them to a state lab, where within about a week we get the results back. And if the person has Zika virus, then they at least know and can take, if you're pregnant specifically, take specific precautions. You can't do anything about it once you have it, but you can do frequent ultrasounds to identify if the fetus has indeed been affected by it.
Once the damage is done with that type of condition, it's pretty much irreversible for the unborn child?
It is. It's completely irreversible. That being said, currently in the United States, there's been about 388 cases as of the last time I looked at the CDC website of reported Zika cases. And a very small subset of that is in positive cases in pregnant women. And then within that, it's actually a fewer number of cases that were actually affected in terms of the fetus, because not every pregnant woman who has it does the fetus get affected. And then even if the fetus is affected, not every case of microcephaly specifically is what has been identified as a direct link, where the brain, the head is, when the baby is forming, the head is formed small. And when the head is formed small, it's because the brain is not developing or doesn't allow the brain to develop properly. Now, not every case of microcephaly leads to actual congenital birth defects beyond just the size of the head. So the definition of microcephaly is the size of the head, the circumference of the head is smaller than expected based upon the age of the baby or the fetus. So in ultrasound specifically, if we're worried about a Zika virus, then a trained obstetrician can do an ultrasound and measure that circumference based upon the age of the pregnancy. They can say if it looks smaller than should be expected. And if it does, it would lead to further testing to make sure that there are no other neurological sort of developments from that, or lack of developments because of that.
As you just mentioned, the CDC has gotten involved. How fearful should we be here in the United States?
So my goal in this interview is not to necessarily instill fear amongst the population, but to educate the population.
Yes.
That being said, I think caution, it behooves us. So taking, it just started affecting Brazil, and we're just about to enter our warm season in the United States. This specific mosquito is most active during the warm season. So it would have to travel now from essentially Brazil, Central America, across the United States border. Either the mosquito would have to travel over, or folks who go there would have to come back with the disease and then start, passing it to one another. So there's a lot of things that would have to happen before it became a true issue in this country. And obviously our public health officials, the CDC, are doing everything they can to be ahead of it. And we're educating the population, which is the most important thing.
As part of the education, let's talk about some of the things we can do to prevent the disease here in the U.S. as we approach these summer months.
So I think, insect repellent is exceptionally important, and specifically EPA certified insect repellents, because there's a bunch of insect repellents out there that are great, but if they're not EPA certified, then we can't be sure they have certain things that actually prevent for this disease. There's a specific compound called DEET.
Yes, that's what I was
DEET.
going to ask about. Should it have DEET?
So what they say is that it should be EPA certified, because there's also a couple other similar things, not only DEET, but there's a couple other chemicals that insect repellents can have that help when it comes to things like Zika virus. And the point ultimately is the insect repellent should actually repel the mosquito from biting you. That's where it actually helps in the Zika virus case. So DEET, up to about 20%, where 20% of the insect repellent is concentrated with DEET, then they say that's the minimum threshold that where it's actually repelling the insect from actually making contact and biting you. They don't smell you, then they don't bite you, is what they say. So EPA certified insect repellent should be used as directed. Usually the insect repellent lasts for about 8 hours and it needs to be applied, but I would read the bottle and follow the instructions that are on the specific one. Then, making sure we sort of cover ourselves head to toe as much as possible to prevent mosquitoes from biting us. Now, I'm not recommending everybody do this everywhere, but especially when we travel, if you travel to these areas, and especially folks who are pregnant, because those are the folks who, if they contract it, it becomes a major issue with the birth defects that we talked about earlier.
Nowadays I hear they're making clothing that's already got the insect repellent in it. Have you heard about that? What do you think about that?
Yeah, so they make a lot of things, clothing, nets, mosquito nets, and what they do is typically they coat it with permethrin, which is a chemical you don't necessarily put on your skin, but you put it on fabrics, and that acts as an insect repellent as well. So I think it's a great idea if you are in a mosquito-prone area, especially with this upcoming summer with the new issue of Zika virus, to take these precautions. Because once we start contracting it and we pass it to one another, that's when these things become an epidemic and become a problem. So if we take these precautions and watch where we travel, when we travel, and especially I emphasize the pregnant population, because that's where it really causes a problem. In the general population, the folks who are not pregnant, it can cause some issues, but vast majority of folks, it's just self-limiting to those, the fever, the joint aches, having red eyes, getting a rash. It's, you don't feel well. And
Does the bite look different with Zika than with any other mosquito bite?
No, the bite looks the same in terms of mosquito bites, so you can't tell. And you'll never know if you actually, a lot of folks don't even know that they contracted it. They're just a carrier because their symptoms, they don't even have symptoms, which is part of the problem. So folks, if you could, go back to folks who traveled to Brazil, could have been carriers. And then when they got there, a mosquito could have bitten them. And then it's such a dense population in Brazil, they're dense areas, and then it can spread very, very quickly.
What's the difference between Zika and West Nile?
So, it's very hard to, from a symptom standpoint, it's very hard to sort of, for the general population to know which one they have. Ultimately, the effects of Zika virus versus West Nile virus is what's important, where Zika is has a direct correlation apparently with these birth defects. West Nile has not been linked that way. That being said, the testing that we do, if you came to the hospital or to your primary care doctor, the testing that is done and set up in the state labs by the CDC is specific for the Zika virus. The testing that is most accurate is within the first week of contracting it, where you're infected with it. That's when the blood is, harbingers it the most that we can test it. Now you can test it afterwards, but then it's sort of a deeper level of test that takes a longer period of time.
Is it a simple blood test, basically?
It's a simple blood test, basically, from when we draw it in the hospital. That being said, when we run it in the lab, it's not a simple blood test, which is why it has to be run in specific labs specifically for Zika.
And it's not something that you can just look at and tell. It's something that definitely has to be tested.
No, a majority of the population, even if they came to their local primary care doctor or their local emergency department, such as Doctors Community Hospital, we would screen you first. Not everybody needs to be tested.
Okay.
The precautions that people need to take is if they're symptomatic and they were in an area that is known to be infected with the Zika virus, they should take the precautions with regards to wearing condoms during sexual intercourse or abstaining from sexual intercourse and any kind of sexual intercourse. That's the precautions that the CDC is advising beyond just the protective clothing and the insect repellent at this point in time. Now, obviously, if and when things change, those recommendations may change. But if you develop symptoms, I think it's a good idea at least to get screened. And then we follow, just like we do at the emergency department at Doctors Community Hospital, we follow the guidelines given by the CDC. If a person, and we coordinate with our local state health officials to decide who needs to be tested, and those tests are then sent to the state lab and followed up appropriately.
Are we close to a vaccine, or is that something that's down the road?
So as of my last sort of knowledge, the United States has appropriated approximately $1.9 billion to the CDC and other efforts to sort of combat and be prepared for the Zika virus. Part of those fundings is to develop a vaccine, but as I'm explaining, it's a very recent phenomenon, a very recent issue to this part of the world. So those efforts are just in their preliminary stages, both on the government levels and also in the private sector. So we're still a ways away from developing it. We haven't even hit any clinical sort of research, clinical trials.
Yes, because people don't realize it's a process. You don't just say, hey, I've got a vaccine.
Yeah.
It's a whole process of testing and other things that you have to go through.
Yeah, part of the challenge is developing an appropriate, effective vaccine. And in this case, we have to have something that's also safe for the pregnant population, of course. So there's certain things that need to be achieved when you're developing a vaccine for that population so they don't negatively impact the fetus and or can cross to the fetus if need be. That being said, once you develop a vaccine, then it has to be tested, make sure it works, and then its safety profile needs to be assessed. So it is quite a long process.
And also with developing a vaccine, once you do develop that vaccine, how would that work as far as who gets the vaccine and who doesn't?
Yeah, I mean, the state officials, the CDC, the government would go about, it really depends on how bad it is right now. If it was a Zika issue, how bad is Zika right now in the country? Do we only need to give it to the pregnant population? How well does the vaccine work? When does it start working? For example, for the flu, we want to vaccinate the elderly, the young, and any sort of folks who are exposed to potentially contracting it, so we don't spread it amongst the population. So there's certain guidelines that are sort of given down by the CDC of who would get the vaccine and when. But there's too many other variables right now to sort of say that if they developed one successfully, which I'm confident they would if in due time, who specifically should get it. But right now, I think the important part is anybody pregnant who's traveled to one of these areas should be tested. Anybody pregnant who's symptomatic with fever, rash, red eyes, body aches, those folks should be tested. At least discuss that with your appropriate healthcare professional to decide if you should be tested. Those folks, if they take those steps and we take the precautions of insect repellent, protective clothing, protective sort of environment when we're in the warm season that is upcoming, I think we'll be successful.
I was also wondering about standing water.
So standing water in general is mosquitoes breed in those areas. So you should avoid leaving standing water around, especially during the warm season that's coming up, to avoid mosquitoes coming to those areas. That's the issue of standing water. But that's sort of a precaution I would take regardless, just to prevent mosquitoes from being in the area.
Is there anything else we should look out for this summer? For example, a lot of kids are going to be outside playing, doing different things, going to the beach or going to the park. Have we seen more of an effect in children, in the elderly, like we do with the flu? You might see it be more serious when it comes to a child or when it comes to an elderly person, or are we just not there yet? We don't know.
Yeah, I think it falls in the we don't know category. I think what we do know is the pregnant population and men who are sexually active. Essentially, those two populations need to take absolute precautions.
Now, again, you mentioned that for men, and we've still got a long way to go as far as finding out exactly what the guidelines are, but you said they're recommending now up to 6 months of abstinence. I know a lot of men aren't going to be happy with that.
Exactly. Abstinence and or wearing a condom every time. Practicing safe sex is exceptionally important for them not to spread it to the woman. Because if you spread it in that case and the woman conceives at that point, as we know, over half of pregnancies are not even planned for.
Yes.
So at that point in time, then you've created the risk of a potential birth defect issue, which can cause serious issues to that fetus. So the pregnant population, if you are planning to get pregnant, you should stay, not try to conceive for at least 2 weeks after having traveled to one of those areas. The men, they're recommending currently about 6 months. And then if you are pregnant, you should be tested, I believe, up to 8 weeks.
So what additional outreach is Doctors Community Hospital doing as far as educating the public? We were talking off air about the fact that 30 years ago, when we were discussing the AIDS virus, there were so many rumors about how you can contract it. People were fearful. I mean, it was just, and we didn't even have the internet.
Yep.
The way we have now. So what are you guys doing to kind of tamp things down, keep things, allowing people to come from a point of knowledge?
Yes, and I think that's exceptionally important. So one is being confident. For example, at Doctors Community Hospital, we have well-trained emergency physicians. So if you came to the hospital, you would enter our Zika sort of process where we would appropriately screen you, test you if needed, and educate you appropriately. We're doing public health outreach, such as me being here today and talking to you and talking to your audience. We're releasing literature. You can come to, you can reach out to us if you have questions. So if there is any issue, we are an absolute resource for our community, and I hope every other hospital is taking similar steps.
So you actually have a process now that the hospital goes through.
Yes, absolutely. In conjunction with our local state health department, in our local sort of county facilities, we have an absolute process that if a patient presented to our emergency department and they presented with these symptoms and they were potentially pregnant or inquired about it, we have educational material we could provide, and we would coordinate with our local state health officials to determine if the patient required testing. And if they did, right there at the hospital, we have all the resources needed, and we would draw those samples, send them to the state lab, and then follow up the results appropriately.
Now, earlier in the program, we talked about the countries that we should be mindful of, but for people who may have tuned in late, what countries are we talking about?
So we're talking about South America, Latin America, and Central America and the Caribbean currently is what has been identified as being the most prevalent areas where the virus is. Now, there have been episodes, for example, in Texas, but those folks had traveled to those areas. So as far as I'm aware of right now, there hasn't been an isolated U.S. case that didn't have some sort of connection to one of these other areas.
That's what I was going to ask you about, those border states like Texas and Florida.
They're the most vulnerable, no question about it, when it comes to things like this. But we have to, be confident. Our public health initiatives are very strong in this country. we do a great job in issues like the Zika virus of not only educating our population, but doing preventative measures, controlling the mosquitoes, doing sort of, if you will, a mosquito campaign to mitigate the mosquitoes from propagating to these areas from those other areas. So mosquito control is very important, and there's already initiatives undergoing in all of these areas that are vulnerable, such as Florida, such as Texas, to minimize the impact. And there's very tight surveillance as well. So if we notice, if the public health officials notice that issues start popping up, they take immediate sort of measures to contain and control so that it doesn't spread to the rest of the population and it stays as controlled as possible.
So when patients come in, do you think in the future that's going to be a question that's automatically asked? Have you traveled outside the country? As you saw recently over the last year or so, I forgot, we had another, wasn't an epidemic, but the first question that you'd be asked when you went to the doctor's office, have you traveled out of the country?
Yeah, so with the Ebola outbreak.
Yes, that's what thank you.
Yeah, you're welcome. So with the Ebola outbreak, that obviously garnered a lot of national, worldwide attention, appropriately so. That being said, even prior to the Ebola outbreak, but especially since the Ebola outbreak, travel history is, at least in our emergency department at Doctors Community Hospital, is a standard question we ask our patients. Because if the answer is yes, and we fit it with the clinical picture of what the patient's symptoms are and what they're complaining about, it can make connections such as the Zika virus.
Okay.
So if someone came in complaining of fever, red eyes, joint aches, headache, malaise, not feeling well, and I said, had you traveled recently? And you said yes, and I would say where? And you said, let's say to the Caribbean or to South America. One of my next questions, if you were a female of childbearing age, is, are you pregnant? I would test you for pregnancy, and that potentially might lead us down a different pathway.
Dr. Chopra, we could do another hour on this. Is such an interesting topic and a relevant topic. But thank you for joining us. You've been watching the Sisters for Fitness Wellness Show. We've been talking to Dr. Puneet Chopra. He's the Chair and Medical Director of Observation and Emergency Services, that's a mouthful, at Doctors Community Hospital. Thank you so much for joining us this afternoon. Have a great day.